Awesome. All right. So, to our questions. So, we have someone that talks about being pre-diabetic and, they're concerned about having to take medication and things of that nature. Is it possible that diet and exercise can actually reverse other health conditions like diabetes?
Yeah, we're really seeing the benefit of that. We're unfortunately we live in a world where we have so much processed food, even I call them junk, healthy snacks. I mean, just because something is gluten-free, no GMO, but if it comes in a package, it's like what's in there, right? So what we're seeing an increase in prediabetes largely related to where people are gaining their body fat. It comes from being less active. It also comes from overeating a lot of things around carbohydrates. So two ways to improve this to avoid taking medication is to increase your exercise. The intervals of intense exercise are actually thought to be more beneficial. And I mentioned this earlier, and we can dig deeper in this. And if you have questions, I can send you articles. But remember, I said that your muscular system is actually hormonally based, is what we're thinking. So, what we've seen is for people that have more muscle mass overall, they have more regulation of their hormones. They're less likely to have to take those medications. So, what am my recommendation? Would I recommend a sprint in the beginning? No, 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 no. But I would recommend looking at your carbohydrate intake, your sugar intake, making sure you're eating enough protein. Okay. And then also, guys, getting in some regular exercise, trying to meet at least 50% of those recommendations will make a big difference in your pre-diabetic markers.
So, you talk about diabetes and how we could potentially reverse it. What about osteopenia?
We've really seen that you can, even for our survivors on hormone blockers. In fact, I have somebody I've been working with. I've known her for 13 years, and she just sent me her last DEXA. And her bone density went up. So can you reverse it? Definitely. Will I tell you it happens quickly? No, but I do notice it for people that do resistance training at least twice a week, pretty regularly, like probably 60% or more of the year, that we see improvements in their osteopenia and osteoporosis, even on the hormone blocking drugs. But consistency is key, guys. So I really recommend, if that's your goal, find something you can stick to, even if it's 10 minutes twice a week versus I'm going to do it for a week and an hour and then not be able to sustain it. Remember, we can't run before we walk. It's kind of like if you sign up for a marathon, you don't start with a marathon, you start with a walk down the block. So thinking about that in the exercise program is really key.
So, Sami, thinking about exercise, and many of us may either be prone to lymphedema or may actually already have lymphedema. So, what are some things you can recommend for us as we're dealing with this challenge?
See, I'm so glad you brought that up because that was on my radar to mention tonight and I missed it. So thank you for whoever brought that up as well. So it's really interesting what we know about lymphedema, especially now at this point in our timeline. So a couple of things. If you have lymphedema, it's going to be a little bit different than if you are at risk. So if you're at risk of lymphedema, there's two really important things. Number one is managing your body fat composition levels, because body fat will slow down your lymphatic system and make you a little bit more predisposed. But another way to mitigate or reduce your risk is actually going to be going back to that magical word of resistance training, because muscle acts as a pump for lymphatic fluid. So if I've lost nodes in my axilla, I want to make sure I'm working my arm, because the arm movement, all of these movements will help push that lymphatic fluid back where it should be. So people will say, wow, I walk outside. I don't know about you guys, but Kansas City has been hot, like 100 degrees hot. You know that feeling in your hands where you feel a little swollen, and that's a little bit of that edema? For most of us, that's going to go back with a little bit of a hand pump and a little bit of recovery. For someone that is at a higher risk of lymphedema, that could be the trigger. So what I always tell people is monitor what you do. You don't want to push to the edge of intensity. You want to think about progressions. So there are exercise recommendations for lymphedema. It's called the PAL protocol. It was developed by Katie Schmitz out of Penn. And it really talks about consistency is king when managing lymphedema, and resistance training is really important. So again, 2 to 3 times a week, shorter bouts, much better than doing one long session per week and monitoring your progressions on a regular basis. Now, for someone that has lymphedema, a little bit different, I would recommend you see a lymphedema therapist to get your personalized recommendations on sleeve or no sleeve. But I think it's really important to note that exercise has been shown to be very beneficial in managing it if you do have it.
So one thing you said a minute ago, you mentioned the word recovery, and you also talked about it on your slides in Carla's plan. Can you really explain to us what does it mean when you say recovery?
So there's two types of recovery. There's active recovery, and then there's full recovery. So I really recommend that you have a built-in day every week where you do what I call active recovery, which typically should be something play. It should be a movement that you can sustain for at least 30 minutes. It could be something like stretching. It could be something like rolling on a foam roller, or doing like a gentle yoga or Tai Chi class or program. Again, online resources are great. It could be taking a walk. It could be anything that's like active recovery, because it will help your body just have that low level movement. We don't always want to be stressing the body. Recovery in general means things like you need a day off of exercise on a regular basis. It might be once a week. It might be twice a week. You need that time to be off. And on that time to be off, that's when you hydrate as much as you can, because your muscles need a lot of water. Your joints need a lot of water, especially if you're menopausal. But really, you need to have that time for your body to repair. So I think it's really important when we think about recovery that muscles only grow during the recovery periods. So that's where sleep is really key. And if you don't have great sleep quality, certainly that's something that I think should be addressed, or we can look into some sleep resources. But making sure you have regular recovery, that's where your muscles grow. It's why when you exercise, you might wake up and you're like, I'm really hungry, because your muscles have recovered overnight. So kind of to reiterate, I suggest one day of active recovery per week. Okay. And then some time off at least every week. And if not, at least once a month, take a couple of days off of doing nothing.
Sure. So what are your thoughts about water aerobics?
I like water aerobics a lot. I think that water is 7 times more resistant than air. So guess what? You're getting some resistance in the water. I think it depends on the type of aerobics that you do. I don't think we've seen enough data to prove a lot of muscle mass gain in water aerobics, where I feel that if our participants are just doing water aerobics, they're not going to get the amount of muscle mass change that I would like to see from a more standard program. That's kind of what the evidence has looked at. But water aerobics is really great for people with a lot of joint pain. If you're managing a high body fat level and you don't want to tax out your joints, if you enjoy water aerobics, if your friends are doing water aerobics, it's really been shown to be a great exercise. It just doesn't usually achieve the amount of muscle mass that a lot of our folks need to see a big metabolic shift and a really big strength shift over time.
So last question for you.
Okay.
You know, many of us have done rigorous exercise before we were diagnosed with breast cancer. And now, you know, that we're having to go through treatment, it's like we're really, really struggling with figuring out what should we do and what should we expect from our new body. So can you give us some tips and pointers on how to deal with this, you know, newness?
Yeah, for sure. So I think the biggest thing to think about, everybody, is just take a moment and realize that you've probably lost a lot of muscle, which also muscles are connected to connective tissue. Joints and ligaments are typically not as supple, which means they don't move as well, especially if you've been on a hormone blocking drug. So I always tell people that you're going to have to bring it back at least a few paces and give yourself a lot of forgiveness on, you know, if you were a brand new baby exerciser, this is the way that it is. I do think that this is a little bit anecdotal. I have found in my experience that most people, and I've seen this predominantly in breast because of the hormone changes, do not have the same threshold of exercise after treatment that they did in the beginning. They just don't. And I think that's a large part due to the muscle. So we call this a lactic acid threshold, which means if you were, you know, walking or running or lifting at a certain intensity, that's coming down by somewhere between 15, 20% right after the back end of treatment. people say to me, can I achieve that again? And my short answer is yes, but it typically comes with such a regimented training program that a lot of people have especially after cancer treatments, have a harder time of recovering. So I always tell people this: if you do exercise, back it off by about 20%. Shorten your length of period to shorter intervals. So do a Tabata, take a minute or 2 minutes of rest. Do a Tabata, take 2 minutes rest. You'll get the same amount of work as if you maybe even ran a 5K, but you're doing that more interval training. And I have found that after cancer treatments, that the overall intensity is higher in this setting than the endurance athlete after cancer treatment. So you're going to have to probably back off a little bit, but I would try intervals because you'll be able to reach intensity, but also have a little bit of built-in recovery, and you'll get a lot more bang for your buck than just going out and trying to run 3, 4, 5 miles again, even if it's something you build up to.